Wilkins.
Nice to meet you.
I just wanted to take out a couple of minutes of your day to discuss an issue that is very important to me.
Yeah, go ahead.
As a registered nurse in Houston, Texas, I've noticed over the last couple of years that we seem to be having a lot more kids at younger ages suffering with mental health issues.
Mm-hmm.
I've also noticed that it seems like the pediatric population, with the growing use of technology and things like Snapchat, Facebook, they seem to have a lot more interaction on social media, and they are a little bit more distant from their families. So although families are there, they're not in tune to what's going on all the time. A lot is kind of hidden. So it seems like since the introduction of social media, there has also been an increase in the number of suicidal deaths in this age group.
Mm-hmm.
Suicide has been the third leading cause of death for those ranging between the ages of 16 and 24. It is also the sixth leading death in kids ranging from ages 5 to 14, which is very young. However, I feel like if we can begin to discuss issues such as cyberbullying and as depression, I feel like this could kind of help subside the deaths that are coming about from suicide. In the state of Texas and across the nation, there is a lack of community support and assistance with providing proper care for those suffering as well as those families assisting with mental health. Mental health costs range around $247 billion a year. That's just not the treatment that's going into mental health. That's also going towards the kids and the families that are lacking from the support of a community support system. So a lot of times what's happening is these kids eventually wind up being suicidal, or they wind up in and out of juvenile detention centers, they end up in and out of jail, or a lot of times they wind up homeless, which are all costs that are affected and impacted by taxpayers. However, I feel like if we were to take a lot of that money that is going towards those facilities and put it into community resources, a lot of that money could be allocated and outsourced. This particular group needs more community resources, including counseling, proper evaluation, and treatment resources. Being an advocate for those suffering with mental health and assisting and decreasing the stigma associated with the diseases needs to be a focus for the healthcare legislation. If we can stop the stigma associated that was actually brought about around the 1950s and 60s, I think mental health could actually be turned around. I am hoping that you can assist me and a group of other nurses with coming up with a legislative bill that can impact